In this video, I'm going to show you the earliest signs of Alzheimer's disease, the subtle clues that can appear years before a diagnosis, often so small that most people dismiss them as simple forgetfulness or stress. But these early warning signs can reveal a lot about what's happening inside your brain, and catching them early can make a massive difference in how your future unfolds. Stay with me until the end, because I'll also share what recent research says about protecting your memory, reducing brain fog, and supporting your brain's ability to stay sharp and youthful. And before we dive in, remember, I'll leave a video below in the description and in the first pinned comment showing a simple 7-second home ritual that could help you naturally restore the memory you had when you were 20 without medications or side effects. Now let's begin. Most people don't realize that Alzheimer's disease doesn't begin when symptoms become severe. In fact, brain changes can start up to 20 years before noticeable memory loss. The earliest signs are often mistaken for stress, lack of sleep, or simply getting older. But Alzheimer's disease, dementia, and other forms like vascular dementia, frontotemporal dementia, or Lewy body dementia start quietly, gradually affecting how brain cells communicate, how your memory circuits function, and how your brain processes information. Imagine your brain as a vast network of roads, billions of connections allowing memories, emotions, and thoughts to travel freely. In Alzheimer's, these roads slowly break down, creating traffic jams that cause forgetfulness, confusion, and brain fog. The key is recognizing these signs early, before those connections are lost for good. Let's look at the first group of early warning signs. One of the earliest and most common symptoms is short-term memory loss, when you forget where you placed your keys, what you were about to say, or the name of someone you just met. Everyone forgets things occasionally, but with early Alzheimer's, this forgetfulness happens more frequently and disrupts daily life. For instance, forgetting parts of conversations, repeating the same questions several times, or missing appointments despite reminders. It's important to understand that short-term memory lapses are different from normal aging. In normal aging, your memory slows, but the information eventually comes back. In Alzheimer's disease, it doesn't. This is due to changes in the hippocampus, the brain's memory center, which becomes one of the first regions affected by amyloid plaques and tau tangles. If you've ever found yourself in the middle of a room wondering why you came in, or noticing that your mental sharpness feels dull, you might be experiencing brain fog, a sense of confusion, lack of focus, or fuzzy brain. Brain fog can have many causes: lack of sleep, poor diet, chronic stress, or hormonal changes. But persistent brain fog symptoms, especially when paired with short-term memory loss, can be one of the first signs of dementia or mild cognitive impairment. In fact, many patients I've spoken with describe this stage as living with a cloudy mind. They're not completely lost, but something feels off. Words don't come as easily, multitasking becomes difficult, and concentration fades faster. And by the way, if you ever feel like your brain is covered by a fog, there's a fascinating video below about a simple 7-second home ritual that may help clear brain fog instantly and reignite your focus naturally. It's in the description and the first comment below. Now, another important early sign of Alzheimer's disease is difficulty finding words. This symptom often appears before significant memory loss. People might struggle to name familiar objects or use vague phrases like "that thing" or "you know what I mean." This occurs because Alzheimer's affects the language centers of the brain, areas like the temporal and parietal lobes. It's more than just forgetting a name. It's about losing access to words that once came easily. Someone might say, "Pass me that thing for drinking," instead of glass. These language difficulties, known as anomic aphasia, can also appear in other forms of dementia such as frontotemporal dementia, which often affects personality and language before memory. Another subtle sign is losing track of time or place. People may forget what day it is, where they are, or how they got there. You might wake up in your own home, but momentarily feel like you're in a different house. This disorientation stems from early damage in the brain's temporal lobe, which processes spatial and time-related information. In the early stages, mood and personality changes can also appear. Many families notice that their loved ones become more anxious, withdrawn, or even depressed. This happens because Alzheimer's and related dementias begin affecting areas of the brain responsible for emotion and judgment, particularly the frontal lobe. For instance, a normally calm person might become easily irritated, or someone social might suddenly prefer isolation. These shifts aren't just emotional, they're biological, the result of neurons losing their ability to communicate properly. You might also notice reduced problem-solving ability, things like managing finances, following a recipe, or keeping track of medications start feeling complicated. People often say, I just don't feel like myself anymore, or simple things take me longer. Let's pause for a moment. If this video is helping you recognize these early signs, go ahead and like the video so more people can learn how to protect their brains, and share in the comments if you've seen these changes in yourself or someone you love. Now, continuing, another major red flag is difficulty performing familiar tasks. You might find yourself confused while using the television remote, forgetting how to use a washing machine you've had for years, or getting lost while driving a familiar route. In dementia, this is called apraxia, a breakdown in the brain's ability to plan and perform learned movements. This symptom is often accompanied by what patients describe as mental fatigue or foggy mind symptoms. It feels like the brain slows down, making every decision require extra effort. The reason? Alzheimer's disease disrupts the brain's communication pathways, especially in areas that coordinate attention and planning. One patient once told me, "It feels like my brain battery drains faster than it used to." That's actually a very accurate way to describe it. As Alzheimer's progresses slowly, visual spatial difficulties may appear. People might misjudge distances, bump into furniture, or have trouble reading maps. This happens because the occipital lobe, responsible for processing visual information, begins to deteriorate. At this stage, some people also experience trouble recognizing faces or places, even familiar ones. This condition is called prosopagnosia, or face blindness, and can be one of the more emotionally distressing symptoms of early dementia. In other cases, early Alzheimer's can show up as amnesia-like episodes, moments where the person suddenly forgets what happened earlier that day, or even feels as though a memory has been erased. This can resemble global amnesia, but the key difference is that in Alzheimer's, these episodes slowly increase in frequency. Now, let's talk about something that often confuses families: the difference between normal forgetfulness and the first signs of dementia. Forgetting where you parked your car is normal. Forgetting that you even drove a car that day or where you are is not. Similarly, misplacing your phone is normal. Finding your phone in the refrigerator and having no idea how it got there is a strong sign of cognitive decline. When you combine memory loss with poor judgment, repetition, and confusion about familiar people or places, it's important to seek medical evaluation. Alzheimer's and other types of dementia like vascular dementia or Lewy body dementia are progressive conditions, but early detection can help slow down their progression. Many people are surprised to learn that vascular dementia, caused by small strokes or reduced blood flow to the brain, can occur alongside Alzheimer's, worsening its symptoms. That's why maintaining healthy blood pressure, cholesterol, and glucose levels is essential. There's also frontotemporal dementia, which tends to affect people earlier in life, often in their 50s or 60s, and primarily impacts personality and behavior before memory. People might make impulsive decisions, become socially inappropriate, or lose empathy. These are not signs of bad character. They're neurological. Then there's Lewy body dementia, which combines memory loss with visual hallucinations and movement issues, sometimes resembling Parkinson's disease. Many patients with Lewy body dementia experience vivid dreams, acting out their sleep, or seeing things that aren't there. Understanding these different types of dementia is crucial because treatment and management strategies can vary. Now let's discuss something many people overlook: brain fog and mental fatigue. Even before an official diagnosis, many experience brain fog symptoms daily, struggling to focus, feeling spaced out, forgetting recent events, or having a foggy head. The main reasons for brain fog include lack of sleep, poor diet, dehydration, chronic stress, and hormonal imbalances. However, when brain fog becomes constant, it could signal underlying neurological changes. Studies show that persistent brain fog can precede early onset dementia by years. If you've ever felt like you're losing mental clarity or forgetting words mid-sentence, it's time to take action. Start with simple habits. Stay hydrated, sleep well, exercise, and include foods that nourish your brain, like omega-3s, antioxidants, and leafy greens. And once again, I'll remind you that there's a short video below in the description about a 7-second home ritual you can do to help restore the memory and focus you had at 20. Many viewers have found it helpful as part of their daily routine for mental clarity. Now, beyond memory loss and brain fog, early Alzheimer's can also appear as difficulty making decisions or hesitation in social situations. People may withdraw from conversations or avoid complex tasks they once enjoyed because they feel overwhelmed. For instance, someone might stop playing chess, baking, or doing crossword puzzles, not because they lost interest, but because those activities now feel mentally exhausting. This is often due to damage in the prefrontal cortex, the brain region responsible for executive function, planning, decision-making, and social behavior. It's also common to see sleep disturbances. Many people with early dementia experience insomnia, restless nights, or vivid dreams. Research shows that during sleep, the brain clears toxic proteins like beta amyloid, the same proteins linked to Alzheimer's. So, lack of sleep can actually increase the risk of brain fog, memory loss, and cognitive decline. That's why developing good sleep hygiene, going to bed at consistent times, limiting blue light, and keeping your room cool and dark can make a real difference in maintaining memory and brain health. Let's move toward practical tips that may help reduce the risk or delay progression. 1. Stay mentally active. Just as muscles weaken without use, your brain needs exercise. Reading, puzzles, learning new skills, or even playing music can help strengthen neural connections. 2. Prioritize physical exercise. Studies show that walking just 30 minutes a day improves blood flow to the brain and supports neurogenesis, the creation of new brain cells. 3. Eat a brain-healthy diet. Focus on foods rich in antioxidants, omega-3 fatty acids, and polyphenols, such as berries, salmon, olive oil, and green tea. The Mediterranean diet has shown strong evidence in lowering dementia risk. 4. Manage stress. Chronic stress increases cortisol levels, which damage the hippocampus and accelerate memory decline. Try meditation, breathing exercises, or journaling. Even a few minutes a day helps. 5. Get quality sleep. Aim for 7 to 8 hours per night. Sleep isn't just rest, it's your brain's detox time. 6. Stay socially connected. Isolation increases the risk of dementia by up to 60%. Maintaining relationships stimulates emotional and cognitive centers in the brain. Let's take a moment to visualize something powerful. Imagine yourself 5 years from now, clear-headed, remembering names, faces, and events effortlessly. You wake up energized, confident, and calm. You can read, drive, and laugh with friends without fear of forgetting mid-conversation. That's what brain health feels like. And it's possible. Even if you've noticed some early signs of dementia or mild memory loss, your brain still has remarkable plasticity, the ability to heal, rebuild, and form new connections. Neuroscientists now know that even in Alzheimer's disease, new neural pathways can form when the brain is stimulated properly. That's why taking care of your body, reducing inflammation, and feeding your brain the right nutrients can make such a difference. And if you're wondering how to take the first step, I'll once again leave a link below this video. It's a short video explaining a 7-second home ritual that has helped many people regain focus, mental clarity, and even recall memories they thought were gone forever. Let's recap what we've discussed. The earliest signs of Alzheimer's disease include short-term memory loss, difficulty finding words, confusion about time and place, changes in mood or personality, poor judgment, and challenges performing familiar tasks. These early warning signs are not just getting older. They're signals from your brain asking for attention. The sooner you recognize them, the more you can do to protect your memory. We've also talked about different types of dementia: Alzheimer's, vascular dementia, frontotemporal dementia, and Lewy body dementia, each with its unique features but overlapping symptoms. We covered brain fog, lack of sleep, and how stress and poor lifestyle habits can worsen mental fog causes. You learned simple strategies to support your brain: proper sleep, hydration, mental exercise, and a diet rich in brain-boosting nutrients. Most importantly, you discovered that it's never too early or too late to start supporting your brain. Now think of this. What would your life look like if you could truly restore the memory you had at 20? Imagine remembering every detail of your life: names, appointments, stories, and experiences without hesitation. Picture yourself feeling sharp, vibrant, and in control again. That's not a fantasy. It's about understanding how your brain works, what damages it, and how to support its healing. The first step begins today, so here's what I want you to do. Click on the link in the description or the first pinned comment to watch the special video I mentioned, the one that shows you the 7-second home ritual to help recover your memory naturally. It's simple, safe, and something you can do right from your home. If this video brought you clarity or hope, please hit the like button so more people can find it. Subscribe to the channel, activate the bell icon, and leave a comment sharing what part of the video resonated most with you. And don't go yet. Right here on the screen, I'm leaving another video that explains how to clear brain fog instantly and keep your mind sharp at any age. Go watch it next. Your future brain will thank you.